State's lead doctor helping guide New Mexico through the pandemic once again gave a status update today on where we stand with COVID-19 and where we could be headed. News 13's Gabrielle Burkhart sat in on the webinar. Gabrielle.
Human Services Secretary Dr. David Scrase went through a lot of data today and addressed concerns about spikes in our neighboring states.
Where we're green and we're in a sea of red, that's a big concern. It's a big concern. The more cases we have in Texas or the more we have in Arizona, that's a problem for New Mexicans.
Now, Dr. Scrase is referring to the COVID exit strategy U.S. map, which shows a spike in cases in our neighboring states after those states relaxed stay-at-home restrictions. And as more people start to travel again, he says there's already been confirmed COVID-19 cases from New Mexicans who've recently attended things like graduation parties and baseball games in Texas and Arizona. So when people see curves going down, Dr. Scrase says it isn't because of the virus changing or improving, but rather overall behavior of people taking measures like widespread mask wearing and social distancing. He also pointed to the science behind why that's important, saying 24% of positive COVID cases in New Mexico are from people who've had no symptoms.
To each take on an individual responsibility for protecting other people in the event that we're one of those 24% of people in New Mexico who have COVID without any symptoms, because that's a really, really big number when you're talking about a pandemic.
Now, Dr. Scrase says the state is also working closely with Los Alamos National Labs to track mobility as it relates to virus spread rate, saying they're finding a close correlation. One of the most frequently asked questions he says the state receives relates to the reporting of recovered cases. Now, when it comes to recovered cases, he says the biggest lag in that reporting can be if someone feels better at home and fails to respond or check back in right away with their contact tracer. Back to you.
Okay, Gabrielle. The state is still hiring more contact tracers each week. The current health order runs through the end of the month.